going over one of the most overlooked areas of your patient's evaluation and how you can help. So if your patient is having a low back pain or any type of sciatica, you must check the psoas muscle. So let's go over how. So what I'm going to do is I'm going to put her leg at a 45-degree angle, right? She's a little bit more than that, so 45 degrees. And what I'm going to say is, Jackie, I want you to push this leg. Please make sure you qualify which leg it is, because I had a patient clock me in the chin last week, and that was not fun. So this leg, I'm going to put you at a 45-degree angle. I'm going to put my hand here. What I want you to do is lift this leg for me. Any pain with that? Okay, let's look at this side. I'm going to do the same thing, push up. So do you feel like there's anything there? Sometimes if you want to roast your patient, you can be like, dude, are you even trying? Not really nice. But Jackie is a full 5 out of 5 strength on this side, so she locks out. Push up, bang. See? This side, push up. See how it's not even moving. So what we want to do is to evaluate that side tells me that there's a problem, right? The other thing that we want to be aware of clinically is if I do this with Jackie and I'm just seeing movement at her thigh, she's just trying to oblige me and do what I'm telling her to do, and she's not actually doing it right. So you want to make sure that when you do this, you're actually getting a valid test, because she's going to try her hardest to do what I'm asking her to do, and she might just be trying to get it done and not doing it in the right way. She just wants to get her leg up, but her leg's not working, and the patient's like, why can't I bring my leg up? So they're just going to bring their whole hip up. So you want to watch for that. So this is the area that has the problem. Just for demonstration purposes, I'm going to treat this side over here. So the secondary test I would do to confirm if that was the issue. Let's do that right now, just for giggles. Bring this leg off the table. I'm going to push your knee straight up to the ceiling. Up to the ceiling. Now see what she did with her leg? I didn't explain that well enough. So I'm going to have her bend your knee, keep this bent right here like this, go straight up. That's pretty good strength. Do you feel any tension right in here? Slight. Okay. Let's try the other side just for a test. Bring this leg up. Was there any in that? Just in the problem that was a little bit weak. So again, that's a positive test that there's a psoas issue. As we know, we cannot palpate the psoas. It's a retroabdominal muscle. So it attaches to the upper lumbars of your patient. So if you think of it pregnant, it really does that. And it attaches to the hip. It's most common with people on their second pregnancy, or if they were an athlete. The reason with a second pregnancy it's an issue is if you typically have a 2-year-old or a 3-year-old, how old is your baby?
15 months.
15 months. So she has a 15-month-old at home, and she's doing this. Typically also your patient will invest in a larger SUV so they can have all the car seats in the back of their car. So they buy typically a bigger vehicle, and that leads to them getting in the car like this, right? And it's typically the one that they're getting into the car with. And then it's also compounded with picking a child up. So those are the two actions of the psoas, is to come up, almost like the bend and snap. So the bend and snap, because somebody just died. So we'll do it again. So it's like the bend and snap, but it's also this is the psoas muscle. Why it's important is it can mimic a disc bulge. So if your patient is having excruciating either groin pain or sciatica, you have to evaluate it, because the psoas is such a cool muscle. It's the only muscle that actually invests into the lumbar disc. So it actually weaves itself, the ligaments weave themselves into the disc. So if it's spasm like her one is on the left, it's going to pull down and throw her pelvis off, but it's also going to really give her some back pain. So the patient a lot of times will say, I have back pain here, and they might even not know that they have a psoas problem. So the next thing that I'm going to show you is how to evaluate that. Again, we cannot palpate a psoas. If you can, you're too deep. So what I'm going to do is I'm going to almost do a reflex point. So I'm going to bring her leg up like this. And a lot of times the patient has excruciating pain. So you have to take this very slow, because I'm actually going to cause her pain. Knowing that, you have to warn the patient and get consent from the patient that that's okay, because you're playing near where their baby is. So what I'm going to explain to Jackie, again, Jackie is 10 weeks, but typically if somebody's like 32, 34 weeks, the baby is near there. So you have to really qualify and be careful yourself, because this is a soft tissue area. So what I'm going to do is I'm going to slip right off of Jackie's ASIS. A lot of women are very ticklish, so I'm going to warn her. So Jackie, it's going to be a little sensitive, okay? But your bone is right here. Your baby is over here, okay? Is that okay?
Yeah.
So I'm going to...
feels really nice.
Yeah, but nice. So if at any point I'm like a water ride, if you want me to stop, we can get off this ride, okay? So I'll stop immediately. So I'm going to slip right off her bone. Now, when I push down, she's either going to like giggle because it tickles, or she's going to be like, ooh, that hurts. And she's not going to expect that. I expect that, and I tell her that that's what's going to happen. So when I push down, it's not that bad, right? But on somebody, it stands up to meet you. So when I push down this, what I'm going to say is, Jackie, I'm going to lift your leg up. When I lift the leg up just for a split second, it's actually going to get worse for a second. It's going to sear for a second, and then it's going to calm down, okay? So I'm going to lift your leg up. See how it fires? The muscle fires, so it comes up to meet me. And then I'm going to bring you over here. Wow. Yeah. But wait, there's more. So even with Jackie not having a problem, the psoas is never a fun muscle to work on. Feel how that's tight?
I felt it in the glutes too.
Yeah, you can feel it in the back and up where it attaches. You doing okay? And again, this is just a reflex point. Let's actually do the symptomatic side, okay? So I'm going to... This side's rough. And Jackie was commenting that her low back and her hips are really already starting to bother her at 10 weeks, second pregnancy. So this is a great check to see whether this is where it's coming from. That's one of the culprits. And she sleeps on the side. So again, same rules apply. I'm going to slip right off the ASIS, or the pointy side of her pelvis. I'm going to bring right off here. And Jackie, that's a lot tighter. So when I say that, when I palpate, it's almost like checking a roast. This side's a little bit softer, so it's like medium rare. This is full well done, right? So it's tight. So I already know there's going to be an issue. So this may tickle or hurt a little bit when I pick your leg up a little bit worse. So I'm going to pick her up. See how she reacts? So we just want to say, is that too much? Are you doing okay?
Yeah.
Isn't that crazy? So I'm going to bring you out like this. So tight. So we just want to rock her. Are you doing okay? You want to check in and make sure she's okay and not be a hero. Because a lot of people, again, they have a white coat syndrome where they just want to do everything that you say and they think that they need to do it. They don't have to do it. There's other tests we can do. You doing okay? If Jackie has a true major psoas problem, a great way to work on this or to address it without digging, or if she has a lot of apprehension, you have to respect that, right? So what I would have Jackie do is to bring her leg off the table like I just showed you, like this. And I would say to bring her knee up. If that's too much, she's like, oh my God, my back hurts, just to sit like this. Now, this is a great home exercise for your patient to go home and lay on the opposite side of their bed or the side of their bed. And just, if they've had a long day on their feet, a great way is just to lay like this to take some tension out of the psoas. And that's the way that we assess the psoas, and that we also give the patient some exercises and also to evaluate it safely for your patient.